Good afternoon, everyone. Thank you for joining us today. My name is Molly Alawade, and I'm the Director of Education here at the American Kidney Fund. Before I turn the presentation over to today's speaker, I'd like to direct your attention to the control panel you should see on your screen. All participants are on mute, so we won't hear you, but we welcome your questions. If you have a question, please type it into the section of your control panel titled Questions. We'll see your question and we'll do our best to answer them, either by replying to you in the questions box or out loud during the last several minutes of the presentation. For those of you in attendance who are health professionals, we are glad you've joined us today and hope you'll recommend this webinar to the patients you work with. However, as a friendly reminder, this webinar is not accredited for continuing education credits. If you believe that your accrediting body may offer you credits for attending this webinar, we'll be happy to send you a certificate of attendance after today's session. Simply email us at education@kidneyfund.org. Without further ado, allow me to introduce today's speaker, Chrystal Okonta. Chrystal Okonta is a technical information specialist with the USDA Food Safety and Inspection Service. In her role, she seeks to protect public health and prevent foodborne illness. She leads educational efforts to improve the public's awareness and knowledge of food safety. She also engages consumers by answering questions about food safety via email, chat, and hotline. She completed a Master's of Science in Public Health degree in Health Education and Health Communication at the Johns Hopkins Bloomberg School of Public Health and is a certified health education specialist. She previously worked in undergraduate admissions at Washington University in St. Louis, her alma mater. Chrystal is an avid reader of more than 50 books each year and is a semi-professional wedding guest and loves ice cream. Thank you, Chrystal, for joining us.
Thank you, Molly, and I'm very happy to be here to talk to you all about kidney disease and food safety and how you can make sure that you're keeping yourself, your family members, and everyone around you safe from foodborne illness. So the beginning of this presentation is really why food safety. Why is food safety so important to keep in mind as you're preparing food? Well, first of all, everybody eats. And I know as the audience here at the Kidney Fund, you know that nutrition is a big part of thinking about how you're going to keep yourself safe and healthy. But food safety is another serious concern because it does sicken about 1 in 6 Americans each year. It can result in about 128,000 hospitalizations, and it causes about 3,000 deaths each year. A lot of us, when we think about foodborne illness, it really, you think, oh, maybe I'll get a stomach ache and won't feel well, have an upset stomach, vomiting, diarrhea, things like that. But it can be very serious, and it's very expensive to treat. So I'm here to educate you a little bit on what steps you can take in your home as you're preparing food and what things you should be thinking about to make sure that you are staying safe from foodborne illness and avoiding these statistics for yourself and your family. So the symptoms of foodborne illness, as I mentioned, some things like nausea and vomiting, upset stomach, cramps and diarrhea. But the serious symptoms that you can find in some cases may be reminiscent of some other illnesses like a fever or dehydration. And those issues typically are what may land people in the hospital from a foodborne illness. So we do encourage people, if you start to feel some of these symptoms and they're not resolving quickly, typically in about a day or so, you may need to seek medical help to make sure that you are staying safe. Some common foodborne pathogens that you may find in your kitchen are things like E. coli, Listeria, Salmonella, or Campylobacter. These are some of the most common ones that you could be exposed to in your home, and so it's really important to keep these in mind. When it comes to kidney disease, however, there are special considerations that you do need to take into account when it comes to food safety. Because when you have kidney disease, if you have any issues with your kidney, that decreased function can lead to increased growth of bacteria. So if you are exposed to something that has foodborne illness germs in it and then have decreased kidney function, it means you may be more likely to get foodborne illness, maybe more at risk. You also are more likely to have longer illness or have it be more severe. So we consider people with kidney disease to have that at-risk kind of status. They are more at risk for severe illness, more at risk for complications that can be very detrimental to their health. Also, if any of you also have diabetes or any other health concerns, the acid production in the GI tract can be affected, and acid production really helps to decrease the prevalence and the severity of foodborne illness pathogens. As food moves more quickly through your digestive system, it means that you're more likely to get sick from foodborne illness. So all of these things are important to think about. It's really a combined opportunity for foodborne illness, so these steps become really important. And of course, if any patients receive transplants, when you suppress the immune system, it makes you more likely to get many diseases, including foodborne illness. You're less likely to be able to fight off that infection. So I'm here today to really go through some steps that you can take to keep yourself safe from foodborne illness. There are other at-risk populations that you should consider as well, because as each of these can come up for you, that may mean that you're even more likely to get sick, and especially as you're around your families and friends, there may be other people that have these illnesses. So we're really trying to protect everyone from foodborne illness and make sure everyone is staying safe, whether you're an older adult, you also have diabetes, you have cancer, you're a transplant recipient, or you have some other immunocompromised status. And then, of course, also pregnant women and children under 5 years of age are at higher risk because of the immune changes that will happen during those situations. So we are here to protect you all and to give you some helpful and simple tips for you as you're moving forward. Now, as you're thinking about foodborne illness, what really can make you sick? A lot of people will think about, oh, I'm at a restaurant and somebody, didn't wash their hands and I got neurovirus and I was very, very sick. But even foods in your home could potentially have foodborne pathogens, foodborne germs that could cause you to become sick. And they generally will fall into two types of categories: uncooked fresh fruits and vegetables, or some type of animal product. So when you think about uncooked fruits and vegetables, anything that's raw, if it's not washed or cleaned properly, if it's not pasteurized, juices, things like that can cause illness. But also many animal products can also have these pathogens as well. So if you're not fully cooking your meat products, if you're eating them raw, if you consume some processed food products like hot dogs or deli meats or deli salads, those products can also potentially contain foodborne illness-causing bacteria, essentially because they can stay out for a long time at certain temperatures that will not be safe for food. So we really want you to be careful and to follow some simple steps to avoid these products and make sure that you're making wise food choices as you go through eating. So our advice is pretty simple. We want you to cook all of your meat, poultry, seafood, and eggs to a safe internal temperature. Make sure you wash all of your produce before preparing or eating it. Even if you are going to eat raw fruits and vegetables, which can be very healthy and important to do, make sure you wash everything. Even if you're going to cut it, even if you're going to cook it, wash it beforehand. Avoid any raw or unpasteurized milk products, cheeses, and juices. Any of those unpasteurized foods are not treated to remove foodborne illness bacteria. So we definitely want to make sure that you're getting those pasteurized products, and you'll see on the label if it's pasteurized or not. And also avoid deli salads, because those can contain things like listeria. And then reheat all your hot dogs, deli meats, and other processed meat products to 165 degrees Fahrenheit or until they're steaming hot. So really what we advise is to choose foods that are more likely to be safe. Choose foods that are treated to be safe. Choose foods that that'll make sure that you're avoiding this potentially serious illness. So the 4 simple steps that we want everyone to keep in mind when it comes to food safety are pretty straightforward. It's clean, separate, cook, and chill. And if you think about these steps as you're preparing any food that you're going to have, it will really prevent foodborne illness for you and your family and your home. When it comes to clean, it's pretty straightforward. We want you to wash your hands with warm soapy water for 20 seconds. We've done several studies in test kitchens watching consumers as they prepare food, and no one really washes their hands correctly. They really don't do it sufficiently. They very rarely do it for the full 20 seconds. And washing hands is not only helpful for protecting yourself from foodborne illness, but it's also just good hygiene practices. You can prevent so many other illnesses, especially as we're in the midst of flu season. I'm sure you're thinking about that. Wash your hands with warm soapy water for 20 seconds. You want to make sure you do it before you start preparing your meal and before you eat. You certainly want to do so after you handle any raw meat, poultry, seafood, or eggs, any of those products that are more likely to contain foodborne illness-causing bacteria. And then also after you use the bathroom, tend to somebody that's sick, feed or play with your pets, anything like that. You really want to wash your hands. And we recommend, if at all possible, to actually use soap and running water when it comes to washing your hands. Hand sanitizers, other products, they can be effective, but the best way to make sure that you keep your hands clean is to wash them with warm soapy water for 20 seconds. So as I mentioned, in a study that we did at the United States Department of Agriculture, found that 97% of attempts that consumers had to wash their hands completely failed. This isn't to mention the number of times that people simply didn't wash their hands when they were supposed to. So it's very important to make sure you follow the 5 steps for hand washing and do them thoroughly. You want to make sure you wet your hands first so that the soap can then lather. Scrub for 20 seconds to physically remove any germs that you may have on your hands. Rinse them with clean water and then dry them with a clean towel. And as you're in your kitchen, thinking about those kitchen towels, they don't remain clean for very long. So you really want to make sure that you're keeping that safe. And now the big controversy, of course, is when it comes to what things should you not be cleaning in your kitchen. We do not recommend that you wash raw meat or poultry before cooking. Essentially, if you wash that, it can spread illness-causing bacteria around your kitchen sinks and surfaces, and washing doesn't actually remove much of the bacteria from the chicken. The only way to really do that is by fully cooking it to a safe internal temperature. So by washing it, you can remove some germs that just get around to other parts of your kitchen, but you're not actually protecting yourself from that. So regardless of what you choose to do, we recommend that you make sure you clean your inner sink and your kitchen surfaces, anything that may touch raw meat or poultry or their juices, with warm and soapy water. That helps to remove that dirt and grime. And then afterwards, you should sanitize it with a sanitizing solution or sanitizing wipes to actually kill any leftover germs. And here is a quick video that you can watch as well to see more about why washing chicken spreads germs. So as you can see, it really goes to show that if you do wash your chicken, you can get potential bacteria around your sinks, your kitchen, and then contaminate salads, other foods that you're going to put directly into your mouth. The foods that you're not cooking are the ones that we want to make sure don't have any bacteria on them, because you're literally putting that into your body, and it has no killing step, no protective steps to make sure that you're staying safe. So rather than washing your chicken, make sure you cook it to a safe internal temperature. Now the next step is separate, and this is really just about keeping any raw meat, poultry, and seafood away from your other foods, any raw produce or any ready-to-eat foods. I think you think about that a lot in your kitchen, but you also want to start doing that before you even get your food home. Keep your meat and poultry separate from other foods in your grocery cart, in your shopping bags. Make sure you clean those shopping bags regularly to prevent any buildup of bacteria, and also store them separately in the refrigerator. You want to keep any raw meat and poultry products kind of at the bottom of your fridge so that the juices don't spread to other foods that you may have in there. You'll keep any cooked foods on top of that, and all your fresh foods, the things that you're going to eat raw. They can either go in the crisper drawers, as long as you make sure no juices can get into them, or at the top of the fridge. It's really a hierarchy to make sure that you're keeping everything safe. You also, during meal preparation, want to keep your product safe as well. make sure you use separate utensils and cutting boards for these different products. The last thing you want to do is cut up a chicken breast or something on a cutting board using a knife and then go straight to chopping up your vegetables that you may be eating directly. That's really not safe. If you don't have separate utensils or cutting boards for these different products, make sure you clean and then sanitize them before you use them for other things. You want to do that between use. That means knives, cutting boards, spatulas, anything like that. And also, you want to keep raw food separate from cooked foods. You don't want to use the same plate that had your, I don't know, turkey burgers or meatballs or steaks that were raw, and then put your cooked food that is safe and has been cooked to a safe temperature, and then potentially contaminate them with the same germs that you found from that could be potential in your raw product. So make sure you keep the cooked food separate from the raw food, and keep your raw meat, poultry, and seafood separate from your produce. And of course, in the kitchen, there's many opportunities for cross-contamination, and kitchen towels can be a major source of that. If you've ever kind of, accidentally spilled some juices out of a package of chicken, let's say, and grab your kitchen towel really fast to wipe it up, that towel is now contaminated. So you want to make sure you have many towels at your disposal. You have single-use towels like paper towels as well. And if you are using kitchen towels, make sure you wash them regularly in hot water to remove the bacteria. You really want to make sure they are fully clean, put them in the hot cycle of the washing machine, and make sure they get very, very clean for your next use. We also found in some of our studies watching people in the kitchen that it's really easy to contaminate other things in your kitchen that you may not think about. So people probably think about, yeah, I turned on the faucet with my, chicken gut pan, and that's kind of gross. But what about your spice containers? Are you touching your salt shaker or your pepper or whatever you use, and then going to touch other things in your kitchen? Make sure you wash your hands really well after you handle any raw meat or poultry products, any seafood. Make sure if you do touch any of those spice containers, faucets, refrigerator doors, make sure you wipe them down, clean them, and then sanitize them with a sanitizing wipe so that you're not spreading that bacteria around other places in your kitchen as well. Now, the next step, and the step that I think a lot of people forget, is the cook step. It is really important. The only way to know if your food is safe to eat is if you cook it to a safe internal temperature. You can't tell by color, by touch, by holding your fingers together and testing the pad of your hand to know if food is fully cooked. It is only going to be safe if it is cooked to a safe temperature. You always want to use a food thermometer for that, and you want to make sure you're making sure each type of food that you're cooking reaches a safe temperature for the different types of germs that could be present on those products. So when you think about the food that you're eating, if you're having a beef roast or pork chops or things like that, those can be cooked to a safe temperature of 145 degrees Fahrenheit. And that's because those products, you really don't find pathogens inside of the meat. It's really about making sure that external section is going to be fully cooked, and that the inner part is going to continue to rest as you go through. So any of those meat, steak, roast, or chops, cook them to 145 degrees Fahrenheit, and then do a 3-minute rest time so it can continue to warm up before you carve it or eat it. For any seafood products, you'll also want to hit 145 degrees Fahrenheit. You can tell with some seafood that isn't friendly to a food thermometer. It must be fully opaque. You don't want to see any of that clear type of look. You really want to see white, fleshy, fully cooked fish and seafood. For any of your ground meat products, your burgers, meatballs, anything like that, taco meat, you want to cook that to 160 degrees Fahrenheit. And with burgers especially, a lot of people, when they go to order burgers, they say, I want it medium, I want it medium rare. Those terms don't really mean much for safety. What we really want to make sure you're doing is cooking it to that safe internal temperature of 160 degrees, because that color will not tell you if that meat has been fully cooked. And because it's a ground product, it means that any potential bacteria could be on the inside, which is why it has that higher temperature. When it comes to a burger, you stick the thermometer into the side of the burger, so it's most effective and you can get the temperature of the center. Don't just stab it in the top, which can happen as well. But definitely make sure to check the thermometer on those products. Any egg dishes, casseroles, quiches, things like that should be cooked to 160 degrees Fahrenheit. If you're eating, a scrambled egg or raw egg, you want to make sure that there's no runny yolks. And then for any poultry product, chicken, turkey, duck, if it's whole, if it's ground, if it's, chicken wings, any poultry should be cooked to 165 degrees Fahrenheit. And that's the temperature where you definitely make sure that any salmonella would be killed. And I think this magnet is something that we produce at the USDA. It's something that I have on my fridge. It's something that I give to all of my friends for housewarming presents, along with a food thermometer, to make sure that everybody is using it. Because I think this really is the most important step. Don't just rely on your experience. Don't rely on the color of the meat or poultry. It's not reliable to tell you if your food is safe to eat. And then the last step, chill. You want to make sure that you're putting your leftover food in the refrigerator within 2 hours after cooking. It is so easy to just, say I'll get to it later. You just spent all that time in the kitchen working, but make sure all your leftover food gets back into the fridge very soon after. If it's above 90 degrees Fahrenheit, if you're lucky, unfortunately it's not here in Washington, D.C., but it's within 1 hour if the temperatures are above 90 degrees that food must be back in the refrigerator. Check the temperatures of your refrigerator and freezer. If you have a thermometer on your fridge, or you can have an appliance thermometer, the fridge should be set to 40 degrees or below and the freezer to 0 degrees or below to make sure that your food is staying at a safe temperature that'll keep it safe much longer than it would otherwise. And there's no real need to wait for your leftovers to cool before you put them into the refrigerator. As long as you pack them into small, shallow containers, basically the size for your next meal or leftovers, that is safe to go into the fridge, even if it's piping hot. And the reason that the chill step is so important is because of the danger zone. Now, this is the temperature at which foodborne bacteria can grow really rapidly. They can double in about 20 minutes in this range. And that temperature is between 40 degrees and 140 degrees Fahrenheit. You do not want to leave your food in this zone, which is basically room temperature, for more than 2 hours because it can really become dangerous. So if you're cooking hot food, you want to keep your hot food hot. So store it in an oven that's set to warm, shaping dishes, slow cookers until it's ready to serve, and it should be at 140 degrees Fahrenheit or warmer. And then you also want to keep your cold food cold. So if you have salads, crudité, potato salad, vegetables, what have you, any cold foods, make sure you either put them on beds of ice or just serve small amounts at a time and then leave the rest in the fridge. That includes things like guacamole, hummus, any of your dips. You want to keep those cold as long as possible. So setting them in an ice bowl or keeping them in the fridge and just pulling out a little bit at a time as people need it is definitely the safest way to go. Of course, there are some exceptions to the danger zone. Foods that are shelf stable and just, stay out on the counter, like cookies, crackers, breads, and whole fruit. They don't need to go in those areas, but once you start cutting fruit, or if you have like a custard that you've baked or things like that, follow the danger zone rule to make sure you're either keeping your hot food hot or keeping your cold food cold. And then also make sure to think about these safe storage times. You want to use all of your refrigerated leftovers within 3 to 4 days. That means either reheating them and eating them or putting it in the freezer for longer storage. Frozen food is the trick that I tell everybody. It is safe indefinitely. You can keep frozen food basically forever. It will be at best quality for about 2 to 6 months once the food is cooked. But you really should use your freezer if you're trying to keep any foods for longer storage. I know I have chicken that has been in my freezer for about a year at this point. I'm very excited to actually use it in my slow cooker this year, but it will be safe for a long time. If you're not sure what the storage time is for the foods that you have, we have an app for that. It's called the Food Keeper. It's available on Android and Apple devices. So you can go to Food Keeper and find this app. It's a really great resource for you. So in summary, you want to make sure you clean, wash your hands and surfaces often, but not your chicken or raw meat or poultry. Separate, so keep that raw meat and poultry separate from other foods. Cook your food to the right temperature and use a food thermometer, and then chill. Refrigerate your food on time. Don't leave it out. All right, so I'm sure you all are aware that Thanksgiving is around the corner, and it's a really important time to keep food safety in mind because maybe you have guests coming from out of town, or you have family members that you may not cook for all the time. Maybe it's the first time you've done a turkey in a year or ever. There's a lot of things that can make large meals and holiday meals really challenging. And foodborne illness can occur because you are cooking a ton of food, so how do you make sure to keep it safe? There's many more opportunities for cross-contamination when you're trying to coordinate cooking all the different dishes at the same time. It is very easy to leave food out for a long time if you go to watch the parade or a football game or just fall asleep. It can be easy to undercook any of your meat or poultry products. And then you may have guests that are at higher risk of foodborne illness besides yourself. So it's really important to keep all of these factors in mind as you're preparing your holiday meals. So our special recommendations for Thanksgiving start at the beginning. If you're buying your turkey, you can choose fresh or frozen, but just make sure that you're treating it safe when you get it. If you're buying a fresh turkey, buy it typically 1 to 2 days before you plan to cook it. Or check your manufacturer's label for a use by or best by date that is through Thanksgiving so that you know it'll stay safe in your fridge until that time. And do not, under any circumstances, purchase fresh pre-stuffed turkeys. Now, if you're buying a frozen turkey, it will be safe forever, but you do want to make sure you're going to thaw that safely. And there are 3 safe ways to thaw. The best is to do it in the refrigerator. Give yourself enough time, about a day for every 4 to 5 pounds of your turkey, give or take another day or 2 so that it's really fully thawed and ready to go. Keep the turkey in the original wrapper and make sure you put it on a tray or some other system to make sure any juices don't go around your refrigerator. But if it's the last minute and you're trying to thaw your turkey right before you cook it, there are 2 safe methods that you can use, either the microwave, check your owner's manual for that, or you can do it using the cold water method, which would be putting it in a bucket of cold water and then changing that water every 30 minutes. And you want to allow about a half an hour per pound of turkey for that. So it'll take a long time, but it'll make sure that your food is safe. You never want to thaw your turkey in the garage, basement, on the counter, on the porch. We have heard all of these stories on our hotline. It is not safe. I don't care how cold it is. I'm from Ohio. It is very, very cold right now there, but it is not safe to do to thaw your turkey outside of these 3 methods. And then you want to keep the 4 steps to food safety in mind, specifically for Thanksgiving. So when you're handling your products, make sure you wash your hands. I mentioned, especially if you're handling that raw turkey. Clean and sanitize any surfaces that come into contact with that turkey with a sanitizing solution. You can even make a homemade one if you don't have a commercial product or don't want to use that. It's just a tablespoon of unscented chlorine bleach for every gallon of water, and you can just spray it down and then wipe it clean to make sure that your surfaces are ready to go when you're ready to cook. You also want to separate everything very carefully during Thanksgiving. Make sure you wash your hands, but also keep your turkey away from all your ready-to-eat foods. Make sure to keep separate cutting boards, knives, and utensils specifically for your turkey. It's a big bird. You're going to use a lot of utensils to handle it, so keep those separate from all the other features that you have. You want to make sure you cook your turkey to a safe temperature. It is only ready when it's 165 degrees Fahrenheit in 3 places. You want to check the innermost part of the thigh, the innermost part of the wing, and the thickest part of the breast. And all 3 of those places, the dark and white meat, must meet 165 with your food thermometer. If you choose to stuff a turkey, you certainly can, but it's safest not to, because you'll also have to make sure that stuffing would reach 165 degrees in the inside of that turkey. And I found personally it gets a little dry to do that, so save yourself the hassle, put it in a casserole dish and cook it on its own. But if you do choose to stuff that turkey, it also has to reach 165. And it is safe to cook a frozen turkey. It'll just typically take a little bit longer. So if you partially thawed your turkey and you can't wait any longer, you have to get it in the oven, it's okay. Just plan for about 50% longer for that turkey as it goes through. And then when you remove the turkey from the oven, make sure that it stands for 20 minutes before you carve it. Don't rely on those pop-up thermometers. They are only good for that one place that it's set. So make sure you still check all 3 places, and don't set your oven lower than 325 degrees Fahrenheit. That makes sure that your turkey gets through the danger zone quickly enough, and make sure that your turkey will stay safe, and cook it all the way through the first time. Don't put it in the oven, take it out to put other sides in there, and then put it back in. Finish it the first time all the way through, and make sure that it's fully cooked. And last but not least, chill, which I think is so important for this holiday season. Don't leave your food out for more than 2 hours. Get your leftovers into containers quickly, and carve that turkey into smaller pieces as well so it can all get into the fridge in a safe way. And then use all your refrigerated leftovers within 3 to 4 days. So that's the Monday after Thanksgiving. If you still have leftovers there, it should go either in the freezer, or if you're not going to eat it, it should be discarded. You shouldn't eat those leftovers after that 3 to 4 days time. And then make sure you're reheating your leftovers safely. Make sure it gets all the leftovers up to 165 degrees. Now, when you're cooking for groups, it can be challenging to balance all of these different things. So we do have some infographics and helpful hints about how you can make sure to keep all of that safe, keep your food out of the danger zone, keep the hot food hot and the cold food cold. Make sure you're using clean utensils and containers to serve your food. Make sure you reheat things in many different places, but always make sure that it hits 165 when you're reheating cooked food. And all of these things are really helpful to keep in mind. So last but not least, we do have some really great resources that are helpful for you. I mentioned the Foodkeeper app earlier for storage advice, and this is a really great app. I use it on my phone all the time. It has advice for more than 600 food and beverage items. So you can really find almost any food that you are interested in on this app, and if you don't, you can send us an email through the app, and we'll see if we can find some storage recommendations for you. It also has recall information if there are any food recalls for either the USDA or the FDA. All the food recalls are available on that app. And it also has tips to prevent food waste. So any of these cooking tips that we talked about today, if you have questions about that, you can actually access several articles through there. You can also sync your reminders to your calendar. So let's say you get through Thanksgiving and you're like, I don't remember how many days I can keep my leftovers in the fridge. You can actually set a reminder in your calendar to remind you when that Monday of Thanksgiving happens, and also ask food safety questions that you may have to myself and other members of our staff to make sure that all of your food is staying safe. Another resource, as I mentioned, is the USDA Meat and Poultry Hotline. We are a very extensive staff with tons of great people that answer questions, food safety experts who are available to you Monday through Friday from 10 a.m. to 6 p.m. Eastern Time. And also, we are going to be available on Thanksgiving Day for your last-minute questions. So if you don't know how long you should be roasting your turkey, or are concerned that you did something that was unsafe, give us a call on Thanksgiving Day from 8 a.m. to 2 p.m. Eastern Time. We're really looking forward to hearing your questions, and that number is 1-888-MP-HOTLINE. You can also chat us live at ask.usda.gov, or email us at mphotline@usda.gov if you do have any other questions, because there are so many things to think about as you're going through and preparing food. So we want to make sure you're staying very, very safe. And of course, a comprehensive list of some other resources that we have. Besides the hotline and the Foodkeeper app, we do have a website in partnership with the FDA and CDC called foodsafety.gov, and that's a great resource for you. You can get a lot of your quick questions answered there, along with some blogs as well. And then we're on social media. Twitter and Facebook are our primary avenues, but we also have videos on YouTube for how to cook different meat and poultry products. We have infographics and other information on Pinterest and Flickr if you want to download those for your use. So please follow our resources and make sure that you're getting all of your food safety questions answered as you go through this holiday season and also beyond, because food safety is a year-long issue. So I just want to say thank you to the American Kidney Fund for allowing us to come in and talk to you about food safety and kidney disease, and then open it up to any questions.
Well, thank you so much, Chrystal, for joining us and for leading such an excellent webinar. So at this time, I'd like to ask some questions that we received from our audience over the course of the webinar. So our first question is, how can I determine if the food at a restaurant is safe?
That's a great question. I know people are very concerned about restaurant food safety because they hear about those things where, oh, I got food poisoning from a restaurant. The most important thing is to make sure people are doing hygienic practices. So the same things that you would do in your home, like washing your hands and keeping food separate from other foods, you're going to want to see that at a restaurant as well. When you're ordering any of the food products, you've probably seen at the bottom of the menu it says, raw or undercooked food can potentially cause foodborne illness. So maybe choose to get your food ordered to a safe temperature. I have no shame. I am not embarrassed about going to a restaurant saying, I'm getting a burger. Can you just make sure it's cooked to 160 degrees? I don't ask for the temperatures, medium or medium rare or anything like that. Just get it cooked to a safe temperature, especially if you do have kidney disease or any of those are part of any of those other at-risk populations. It's really important to make sure your food is fully cooked to give you your best shot of avoiding foodborne illness.
Great, thank you for that explanation. So our next question is, where can I obtain resources for patients regarding safe handling of poultry? Are there resources in various languages?
Yeah, so we do have resources in English and Spanish for any food safety questions. If you go to the website I mentioned, ask.usda.gov, you can search for questions about how to handle meat or poultry products. We also have other questions that have just come up about other products as well. And you can also call us. We have agents available in both English and Spanish to answer those food safety questions. Foodsafety.gov is also available in Spanish, so you have lots of mechanisms to get your questions answered and to make sure that you're handling your poultry properly, handling all your food properly, and keeping your family safe.
Great, thanks for those resources. So our next question is, how can I check if meat is properly cooked if I don't have a food thermometer?
That is a very good question, and it's kind of a tough answer. It's really hard to know just by the amount of time or, again, the color of a food product to know if it's been fully cooked. If you don't have a food thermometer, if you're not planning on getting a food thermometer, though I do highly recommend it, you just want to cook it to that longer end of any of those cooking instructions. You really want to make sure it is very warm. Some other things that you can do as well are cook it through things like a slow cooker. When you're using a slow cooker, it creates a chamber, a moisture chamber that makes sure that your food is fully cooked over that long time, and you'll know it's done when the meat has reached several hours in that time. But as I mentioned, really the only safe way to know is if you do use that food thermometer. So if you don't have one yet, there can be very inexpensive ones at your local grocery store. You can also call our office for recommendations as well. We definitely would recommend getting one of those and just being sure every single time that you cook food that it's at the right safe temperature.
Great, that's good to know. So our next question is, do all hand soaps kill bacteria or only the ones that specifically say they do?
That's a great question, and hand washing is such an interesting thing to think about because it's not really just about the soap. Hand washing actually uses how much you rub your hands together to physically remove a lot of the germs. So you can use antibacterial soap, you can use bar soap, you can use the foaming soap. There's so many different types of soap out there, but as long as you're scrubbing your hands for 20 seconds and then drying it with either a clean one-use towel or another clean towel, or even using those air dryers that you'll find at some public restrooms that are very powerful, those are ways to additionally physically remove any more of those products. So you don't have to just have an antibacterial soap product. Any soap is better than nothing. And again, if you don't have soap, hand sanitizers can work. Just make sure that you rub them all the way through, use enough. Really follow the directions on the back of the hand sanitizer bottle to make sure you're using it properly, and that you're getting inside the inside of your fingers, under your nails, on your palms, up your wrists. Make sure your entire hand, not just the parts that you think about, are staying clean.
Very good to know. So our next question is, why is undercooked beef safe to eat, but not undercooked chicken?
So I would argue that no undercooked food is safe to eat. Beef typically, beef can stay red at a safe temperature. So the color as people think about it isn't really a good indicator of saying, oh, this is ready to go. So the reason why we have these different temperatures for different types of meat products is basically based on what types of foodborne illness-causing germs are likely to be in those products. So when you think about chicken and turkey and things like that, you're thinking about salmonella. And at 165 degrees Fahrenheit, salmonella is sure to be eliminated. So that's why we recommend that temperature. But for a beef product, if you're cooking a roast, you may still have that red color even as it's reached that safe internal temperature of 145 degrees Fahrenheit. But it's not really that it's undercooked. It's just the temperature that eliminates the germs that are most likely in that product are cooked out on the outside of that product at 145. So you really have to think about the individual type of food that you're cooking and what temperature would get rid of the risk instead of just relying on the color.
All right, I didn't know that, Chrystal. Thank you. So our next question is, you said to keep raw meat separate from raw produce. But what about cooking videos where they bake raw vegetables in the same pan as raw meat? Isn't that a bad practice?
That's a great question, and I think baking is definitely one of those spaces where a lot of things can happen that you just wonder, is this really safe? When it comes to cooking, a roast, a whole chicken, anything that has a piece of meat or poultry and any vegetables surrounding it, as long as everything is cooked to 165 degrees Fahrenheit, it is safe to do that. So any of the juices that may come out of that bird that provide flavor but also could potentially provide foodborne illness, as long as that product is cooked to 165, you're killing it. So it really ends up being about making sure that food is fully cooked, making sure that food reaches that safe internal temperature, and if you're uncomfortable with it, you can always separate it. You don't have to cook those products in the same space. You just want to make sure that any meat or poultry product and its surrounding foods reach the same safe internal temperature.
That's a great explanation. All right. So now we have a couple questions about cleaning. So this question is, should I use a different sponge to clean cookware that had raw meat, or should I use the same sponge to clean all my dishes and utensils?
That is, definitely a challenge to balance what types of things you should be doing. I think best practices say, sure, use separate sponges for your raw meat and poultry compared to things that held, cooked foods or vegetables or things like that. Another thing that you can do, though, is anything that can go in the dishwasher goes through kind of a sanitizing process. So the dishwasher could be an easy way to kind of sidestep those types of issues. But when it comes to any sponges, you do want to make sure that you are using sufficient soap to get the product clean, that you're replacing them relatively frequently, and then once they start to show signs of wear and look like they're getting run down, that you throw them away and use a new one. Because once it starts to wear down, that's where any potential bacteria could hide in those crevices, in those cracks, any of those places where it starts to peel off. I know I've kept some sponges a little too long, and it starts to look very sad, and they also don't work very well. So as long as you're using your sponge, as it is, and it's not looking worse for wear, it's not hiding any bacteria in there, it's fine to use the same product. You just want to make sure that after any of the products that held raw meat or poultry, after you clean them with hot soapy water, you're also making sure to sanitize them. Don't just rely on soap and water to get them clean.
Great. So somebody else asked, what are the best practices for cleaning the sink?
That is such a good question, and we spent so much time. Our recent study for the USDA focused so much on washing chicken and what that looked like moving forward. So when it comes to the sink, you want to make sure first of all, you clean it and sanitize it immediately after it's touched any of those raw meat or poultry products or juices. You don't want to wait and forget or prepare other foods in that sink. So the first best practice is to use warm soapy water and your sponge, or a separate sponge just for the sink, to clean that area. Basically what the cleaning does is remove dirt and grime. So you're trying to get any of the the big pieces that you can see away from there. You want to make sure you do the entire inner sink and also the surrounding surfaces, because those are the places about 0 to 6 inches away from the sink itself. That's where it's most likely for any of those juices to spray and to be an issue. So wipe down that area with warm soapy water. Once you finish cleaning it and you've rinsed it, then you're going to go in with a sanitizing solution or sanitizing wipe. And you want to make sure you follow the manufacturer's directions on the sanitizing solutions if you're using a commercial product or the sanitizing wipes. But if you're using a homemade solution, you really want to spray it down and soak it, and then either wipe it with a one-use towel or let it air dry if you're kind of at the end of your meal preparation. The most important part when it does come to cleaning and sanitizing the sink is to do it immediately after it's been exposed to any potential pathogens, and after it's, after you dumped turkey juices in there, after, you accidentally dropped a piece of steak in your sink. I don't know, it happens to me sometimes, but there's lots of different times when you're going to want to make sure that sink is getting cleaned immediately.
Great. So another cleaning question, what should I use to wash fruits and vegetables?
That is a great question, and I will say that here at USDA, we really focus on meat and poultry. We're not the experts. But I do have some information from FDA about how to clean your fruits and vegetables. And really the advice is use clean running water to do so. You don't need to do commercial sprays or commercial washes. Really the act of running water is going to be sufficient. But for any hard-skinned fruits or vegetables, any melons, anything that has grooves, you actually will want to use a brush to with the water that you're using to make sure that it stays very clean. You're getting any potential bacteria outside of those pathogens. There have been, some high-profile recalls when it comes to things like lettuce, things like that. As long as they're washed, you're able to remove that, because those aren't you're not getting foodborne illness-causing bacteria like from the way that the product is growing. It's typically contamination from how it's handled and processed. So as long as you're using that running water and making sure that you're getting into any crevices, that will be good enough to keep you safe from foodborne illness.
Wonderful. That's a great explanation. So another question is, why do we have to wash our hands for 20 seconds and not a longer or shorter amount of time?
Yeah, so the science for hand washing is from the CDC. They have done a lot of studies on what time in hand washing is sufficient, and that is based on a series of studies that they've produced. So if you go to CDC and check out their hand washing page, they actually have the official studies where they came up with that 20-second recommendation. Essentially, 20 seconds is an abundance of caution because we know most people don't wash their hands well. So when it comes to 20 seconds, we really recommend that, because then we're sure pretty much that people have been able to reach all parts of their hands. They've been able to scrub it sufficiently to get any of the germs off of their hands, and it's safe in that way. But you should be noted that these studies were done with bar soaps and about 20 years ago, so the technology that comes with soaps has changed a little bit since then. So we're actually working very closely with CDC right now to see if we can update these recommendations and really think about some of the different types of products that people are using in their kitchens and what types of hand washing and techniques we can recommend to people to make sure that they're doing it sufficiently, that they're getting the best bang for their buck when it comes to hand washing. And I know during the winter my skin gets really dry, so we want to make sure we're not drying people out too much as well, because those cracks and cuts can also harbor germs and can be very dangerous as well.
Yeah, that's really good to know. Okay, so we have another question about hand washing. Are there any consequences of not drying your hands after washing them?
Yeah, so drying your hands is another way to physically remove any leftover germs. It's really not recommended just to let your hands air dry because you're not getting that additional layer of protection by drying them. So, either the mechanical air dryer or using a towel, whether it's one use or a clean towel, is the best way to make sure you're minimizing risk. Essentially, it's like how much of the bacteria can you reduce from your hands, and that drying step is a critical additional way to get rid of more germs that could cause foodborne illness.
That's good to know. So another question that we received is, how long does it take bacteria on a kitchen surface to die?
Yeah, so it depends on the specific bacteria and the conditions in which it's sitting. Typically, the most common foodborne illness-causing bacteria can stay on your surfaces for anywhere from 4 hours to up to 36 hours, which is why it's so important to make sure that you're really cleaning and sanitizing all of your sinks and surfaces and making sure that they're staying safe. You could do everything right during the cooking process. And at the very end, you know, you dumped out some chicken juices, and then you go off for the rest of your day. You could come back the next day and go to wash an apple that you're going to eat and end up contaminating that product because some bacteria could splash up from that sink that wasn't fully cleaned and sanitized onto your food. So we really advise people to do that step right away. Don't leave it till later because that bacteria can last for a long time on those surfaces.
That's very good to know. So another question we received is, can you reheat leftovers more than once?
That's a great question. I mean, it's not best practice for quality, but in terms of safety, as long as you are fully reheating your vegetable, your leftovers to 165 degrees, and then if you don't finish them, you get them back into the refrigerator or freezer. In theory, within 2 hours, that would be safe to reheat again. But I think best practice really is to remove the food that you're going to eat at one time, not only for quality reasons, but also because every time you reopen that package to an unsafe temperature or the environment, you run the risk of increasing foodborne illness-causing bacteria. It also can tend to, you know, spoil a little faster and be less pleasant. But in terms of safety practices, it really is best to try and, you know, only reheat the product that you're using. Keep the rest either in the fridge for those 3 to 4 days or into the freezer for longer storage. When I go into my fridge, after I finish cooking, I meal prep for the week and make sure everything is in the size that I'm going to eat for lunch or dinner the next day, so that you don't end up having to reheat food multiple times.
Good, that's good to know. So another question we received is, what is the best way to clean and sanitize my cutting board?
That's a great question. So when it comes to the cutting board, you clean it as you would any other utensil. Use a sponge, soap, warm soapy water, as warm as you can stand, I think, when it comes to washing that. And then make sure it's fully washed and rinsed. When you get to the sanitizing components, if you're using a homemade sanitizing solution, you want to either soak it in that solution or spray it on and then let that solution air dry. That's the best way to make sure that any bacteria left on the product after you cleaned it is fully removed. When it comes to other products like knives, I know a lot of people are very hesitant to fully soak those things, so it may be easier then to use a sanitizing wipe or something that doesn't leave, that you're not pouring on a ton of solution. But regardless, it is important to do both of those steps, so clean it and then sanitize it.
All right, that's great advice. So we also received this question. If the produce package says washed and ready to eat, do you still need to wash it anyways?
That's a great question. And from FDA, their recommendation is no. Once that package says washed and ready to eat, it's ready to eat. The reason why they don't recommend washing it after you have that is because you run the risk of contaminating it from your own kitchen, from your own practices. So, you can use that produce directly from the package. I tend to use those products for, I have guests over, if I have like a broccoli tray or something like that. You really can just pull them out of the product, but only if it says that information. You should not do that for any of the other produce that you have, only if it says washed and ready to eat.
Okay, that's good to know. All right, somebody else wrote in and asked, where I come from, we wash our chicken with lemon and water. Is that okay to do?
So we have this debate often on Twitter with a lot of people all the time. It's very much something that people care a lot about, that they say, my mom did it, my grandmother did it, everybody in my family does it. I'm not going to stop doing it. The reason we don't recommend it is really because of the risk of spreading bacteria around your kitchen. The only safe way to get rid of anything on the chicken is by really making sure that you just don't. That's the only way to do it. I can't really give other advice beyond that. If you choose to do it, just know that things like salt and lemon don't actually kill bacteria. I think that's a common misconception that people have. When it comes to actually washing it, it's so much more important that you make sure that you both clean and sanitize the sink and your utensils immediately after you do that. We found in our study that about 25% of the salads that people prepared after they washed their chicken were contaminated with our tracer bacteria in our study, which meant that about 25% of people, if they ate that product, would, again, just be putting it into their body. You can make your choices. We just want to make sure that you're staying as safe as possible, and the best practice really is to make sure that you don't wash your poultry.
That's good to know. All right, so we've come to our last question for the webinar, and this one comes from a transplant patient. Should transplant patients eat at a buffet?
So we don't recommend for transplant patients to eat at buffets, mostly because the way that you handle food at buffets, it keeps them out for a very long time. Even if there's chafing dishes or warming trays, or if the cold foods are kept at a, in bowls of ice, it's a high-risk product, and it's really important that you're making sure that you're taking care of your immune system and that you're reducing the risk of that transplant being rejected. So when it comes to those foods to avoid, it really means avoid them. Don't expose yourself to unpasteurized products. Don't expose yourself to uncooked meat or poultry products. You probably should avoid any of those processed foods like hot dogs or deli meats completely during that time, just to make sure you have the best chance of that transplant really being safe for you. And instead, make sure all your food is handled safely, it's fully cooked, and ready to go.
All righty. Well, thank you so much, Chrystal. And this concludes today's webinar. This webinar was recorded and will be made available for viewing on our website, kidneyfund.org/webinars, within the next 1 to 2 weeks. Our next webinar will be about balancing kidney disease from a teenage perspective. The webinar will be held on Thursday, December 12th, and hosted by Dr. Ken Sousa, a pediatric nephrologist, and Bailey Park, a teen advocate. Registration is now open. Visit kidneyfund.org/webinars for more information and to register. When the webinar closes, please do not close your browser window. You may see a pop-up saying that the webinar has ended. Please close that pop-up and proceed to the webinar evaluation survey. Your honest feedback will help us make our webinar program the best it can be. Thank you for joining, and we hope to see you again.